In this video, we are going to be looking at the topic History Collection of Female Reproductive System. Hi, I'm Sharon. I'm working as an associate professor at M College of Nursing. The following are the objectives that we'll be addressing in this video. A comprehensive history collection of the female reproductive system is a vital component of holistic health assessment. It provides valuable insights into a woman's menstrual, obstetric, gynecological, sexual, and reproductive health across the lifespan. Accurate and sensitive history taking helps in early identification of disorders, planning appropriate investigations, and delivering individualized care. This presentation highlights on it. The nurse has to elicit general as well as reproductive health information. The nurse has to be more alert that the reproductive and sexual issues are personal and private. Hence, developing trust is essential to elicit sensitive information. The nurse has to maintain a professional demeanor and use gender-neutral terms and be culturally sensitive. The nurse has to start with the least sensitive questions before moving to sensitive topics like sexual practices and sexually transmitted infections. In the past health history, ask about major illnesses, hospitalizations, immunizations, and surgeries. Also inquire about infections involving the reproductive system, including STIs. Get a complete obstetric and gynecological history. Rubella is of primary concern to women of childbearing age. In the first 3 months of pregnancy, there is a possibility of congenital anomalies increasing. Hence, encourage immunization before pregnancy. Avoid rubella immunization during pregnancy, and once immunization is achieved, avoid conception for at least 3 months. Question regarding current health status and any acute or chronic health problems. Problems in other body systems are often related to problems with the reproductive system. Ask questions relating to possible endocrine disorders, particularly diabetes mellitus, hypothyroidism, and hyperthyroidism. Women with uncontrolled diabetes mellitus may have significant health risks, especially in pregnancy. Many other chronic illnesses such as cardiovascular disease, respiratory disorders, anemia, cancer, and kidney and urinary tract disorders may affect the reproductive system as well as sexual functioning. Also determine if the patient has a history of stroke or MI. A history of cardiovascular disease, example hypertension, thrombophlebitis, angina, is associated with a higher incidence of morbidity and mortality with pregnancy or the use of oral contraceptives. Coming to the medication history, document all prescription and over-the-counter medications that the patient is taking, including the reason for the medication, the dosage, and the length of time that the medication has been taken. Ask the patient about the use of herbal products and dietary supplements. Particularly relevant is the use of diuretics, which is sometimes prescribed for premenstrual edema, and psychotropic agents, which affect sexual performance. Note the use of alcohol, marijuana, barbiturates, amphetamines, or phencyclidine hydrochloride, which can have serious behavioral or physiological effects on the reproductive system. It is important to document the use of oral contraceptives or any other hormonal therapy. The long-term use of both estrogen and progesterone appears to increase the risk of blood clots, cardiovascular disease, stroke, and breast cancer in postmenopausal women. The short-term use is appropriate for women experiencing moderate to severe menopausal symptoms. Women who use tobacco have a much higher risk of clotting disorders. It is also important to note that a history of cholecystitis and hepatitis may be contraindications for the use of oral contraceptives, because cholecystitis is often aggravated by OCPs, and chronic active inflammation of the liver generally precludes the use of estrogen products because they are metabolized by the liver. Chronic obstructive pulmonary disease may also be a contraindication to oral contraceptive use because progesterone thickens respiratory secretions. Inquire regarding any surgeries that are done in the health history, especially in the reproductive system. Also document for any therapeutic or spontaneous abortions. The following are the references. Thank you.